Okay guys, let's talk about sedative and hypnotics pharmacology. So, insomnia is the inability to fall asleep or to stay asleep. And in the United States, around 1/3 of their population are suffering from insomnia. And insomnia has also cost the United States workforce $63 billion annually due to reduced performance of their workforce. Let's go in now. So, they cause CNS depression that lead to calmness. The purpose of this sedative and hypnotics mainly is for seizure reduction, for muscle relaxation, for somnolence, and for general anesthesia. So, know that sedatives are minor tranquilizers that reduce anxiety, while hypnotics are major tranquilizers that treat depression. Example of drugs here are chloral hydrate, alcohol, antihistamines, buspirone, melatonin agonists, SSRI and SNRIs, barbiturates, meprobamate. Take note of that, guys. So let's talk about the first class of drug here, the benzodiazepines. They are the most widely used sedative hypnotics. They have these properties, these anticonvulsant properties. The mechanism of action of benzodiazepines is that they bind to GABA receptors to increase frequency of channel opening. In this case, there's opening of chloride channels, so it increases the frequency of the opening of chloride channels. The pharmacokinetic of benzodiazepine is that they are lipophilic, so they are rapidly absorbed after oral administration. They are metabolized in the liver. They are excreted as glucuronides or oxidized metabolites. The classification of drugs here, we have the short-acting, the intermediate-acting, and the long-acting. For the short-acting, just know that we have midazolam, triazolam. For the intermediate-acting, we have lorazepam, we have temazepam, we have alprazolam, we have estazolam. So for long-acting, we have diazepam, we have quazepam, we have nitrazepam, we have flurazepam. Guys, let's move on and talk about the next thing here, which are the side effects of benzodiazepines. So they cause drowsiness, confusion. In overdose, it causes coma, but not death. Don't forget that we use flumazenil to reverse benzodiazepine poisoning. Benzodiazepine cross placenta abrupt discontinuation result in withdrawal syndromes that comprises of confusion, anxiety, agitation, amnesia, restlessness, early morning insomnia. Guys, let's talk about the next drug here, which are the non-benzodiazepines. The pharmacokinetic of non-benzodiazepines is that they are rapidly absorbed from the GIT. They undergo hepatic oxidation by cytochrome P450 system, and they are excreted in urine. Example of drugs in this class are zolpidem, xyloplone, esopiclone. Guys, the third class of drug here are the sedating antihistamines. They are effective in treating mild forms of insomnia. The side effect of sedating antihistamine is that they have this undesirable anticholinergic effect. Example of drugs in this class are promethazine, diphenhydramine, deoxylamine, hydroxyzine. Guys, let's talk about the fourth class of drugs here, the barbiturates. So the barbiturates have this CNS depressant effect and toxicity more than benzodiazepines. And another thing about this barbiturate is that the mechanism of action of the drug is that it interacts with GABA-A receptors to enhance GABAergic transmission, and they also block excitatory glutamate and AMPA receptors. So the pharmacokinetics of barbiturate is that they induced cytochrome P450 microsomal enzymes in the liver, and most of the barbiturates are excreted as inactive metabolites, except for phenobarbital that is excreted unchanged in the urine. Classification of barbiturates: short-acting, ultra-short-acting, long-acting. Let's talk about the ultra-short-acting. Example of drugs here are thiopental. For the short-acting, we have pentobarbital, we have secobarbital, amobarbital. For the long-acting, that lasts for 1 to 2 days, we have phenobarbital, which is the most recognized drug in this class. Guys, the side effect of barbiturates. They cause depression of the CNS, depression of the cardiovascular system, depression of the respiratory system. An abrupt withdrawal causes cardiac arrest, tremor, anxiety, restlessness, seizure, nausea, vomiting, delirium, and death. So you can see the barbiturates are really dangerous. So for buspirons, I want you to know that buspirons are sedative agent useful for chronic treatment of general anxiety disorders. And it is a very good drug because the mechanism of action of this drug is that it is a partial agonist of serotonin receptors and also an antagonist at dopamine D2 autoreceptors. So you can see the benefit of these drugs here. Dependence is unlikely. There's less interference with motor and psychomotor and cognitive functions. Disadvantage of these drugs is only that it lacks anticonvulsant property and it also lacks muscle laxant properties, and is also not effective for what? For acute anxiety states, but it is only effective for what? For chronic general anxiety disorders. Side effects of buspirons are minimal sedation, hypothermia, headache, nausea, dizziness, nervousness, fatigue, lightheadedness. Guys, buspirone is a very, very good drug. It's a very good drug. So, antidepressant like the selective serotonin reuptake inhibitors and the serotonin norepinephrine reuptake inhibitors. So, indication of these drugs is that they are used alone or in combination with what? With a low dose of benzodiazepine for managing long-term symptoms of chronic anxiety disorders. Just like what? Just like buspirone. So, advantage of antidepressants is that they have this lower potential for physical dependence than benzodiazepine. So you can see at this moment we can say that buspirones and antidepressants like SSRI and SNRIs are good sedative and hypnotics with less side effects. So the last class here are the ramelteon. So ramelteon is a selective agonist at MT1 and MT2 subtypes of melatonin receptors. They are used to treat insomnia in which falling asleep is the primary complaint. Advantage of this drug is that it has this low abuse potential, it has minimal dependence, it has minimum withdrawal effect, and it can be administered long time. But the disadvantage of ramelteon is that it causes dizziness, fatigue, somnolence, and increased prolactin levels. Guys, bye for now.